does.
Uh-oh.
When you were just like letting your hair hang down and stuff, you don't do that anymore. I don't know what happened.
That's once a year.
That's something, honey.
All right, this is our very last chapter of the semester. Where did the time go? I don't even know.
Oh, we are so happy it went.
Next semester is going to be a little bit tougher. No more patient care. It's going to be radiation physics.
Oh.
Are you teaching it?
Are you ready?
I'm ready.
Are
Y'all
you-
ready?
I'm ready. I'm always ready.
Oh, okay.
I thought it was gonna be nothing but Mr. Fun, so.
Oh, yeah.
What is
Oh, why
it
you
teaching
say
us?
that?
Theory?
You already
I
have to.
don't think I can do
It is
I don't think I can do fun, bro.
and theory and then whatever.
I feel like just end me now. I'm just gonna leave.
Sit me down. Sit me down.
You see how much we love you because we're excited that you're gonna teach it?
That's right,
Well, let's hope things go smoothly.
Oh, it's gonna
It's the first time teaching, huh?
Yes.
Oh, God.
I think I like physics better than patient care.
Okay. Okay, we gonna see. We gonna see what
Yeah.
you're working with.
All right.
Yes, I'm ready.
Never mind. Take it back.
All right, so chapter 23, contrast media and introduction to radiopharmaceuticals. We're going to talk about why we use contrast media, how it affects our imaging studies, and also talk about radiopharmaceuticals. So, page 282, these are some of the keywords that you have to know for your test. Contraindications, what do you guys think that means? Okay, but give
Don't.
me more in depth.
Don't use contrast.
What, it will not be good for you to use contraindication. If a medication is taken, it will not be good for you.
Correct. So contraindications has to do with a patient's specific medical history or what they're currently experiencing. So for example, if a patient comes in with a very low GFR, meaning their kidneys are not functioning that great, so contrast would be a contraindication.
Can't get
right?
it.
Yes. And if a patient is allergic to a certain type of contrast, that would be another contraindication. Creatinine, do you guys know what that is?
That's the stuff that they use for the kidneys. Yeah.
Okay, so creatinine is a waste that's excreted by your kidneys, and so it's a product of metabolism. So if your body contains high levels of creatinine, that means your kidneys are not filtering that great. It's not getting rid of the waste. So usually before CT scans, we check the creatinine levels of patients, and if it's high, that means they have a very low GFR.
What levels, ma'am?
Creatinine levels. Extravasation, we should know what that means by now,
Yes, you should.
which is
They didn't hit the van.
when
Just
a
leakage.
vessel is leaking out into the surrounding tissues. Flocculation. Do you guys remember what I said about that? Has to do with barium. So that happens when a suspension or a solution forms clumps and becomes like flaky. For example, barium, if it's not made correctly, it can cause flocculation and become very clumpy. That's toxic inside our body. So they have special ingredients that are added in the barium itself that prevents flocculation. Another example of flocculation is if we were to add lemon juice to milk, what happens?
Gurgulates.
Curd, it becomes like clumpy, right? So it spoils. What about a histamine?
Histamine is anti-allergic.
So it's released by our body in response to an allergy. So these are substances released in our body that cause our bronchi to constrict and for us to have low blood pressure. What happens during low blood pressure? Remember our hose analogy?
Systolic decreases.
So if our vessels are dilated, we have low blood pressure. If our vessels are constricted, we have high blood pressure. Just like a hose with water
or positive?
Maybe.
Negative.
See it negative.
No.
I think that's what the book says, right? Or it doesn't say any.
Choose
Ionic and then anions are positive charge and cations are negative charge.
Yes,
That prison life coming out.
Just
So basically ionization, both is ionization.
correct.
And negative ionization is
like Jamaica right now.
cation, and positive is anion.
Yes. Osmolality. What is that? Yes.
It says, well, it does say it's negative or.
The ability to transfer water, isn't it?
So that's talking about the number of particles within a solution. So basically, it's measuring the concentration of
It
the
says
chemical
negative
particles
charge or-
within blood.
Oh, so it's like molar quantities and all that,
Yes.
right?
Osmosis. What
Water-
is that?
Water travels.
So it's
Hey.
the movement of water from an area of high concentration to an area of low concentration through a semi-permeable membrane such as blood vessels.
Gosh, I haven't heard some of these words since like freshman year of high school.
Radiopharmaceutical. What do you think that is? It's a type of medicine. Radio means radiation. So that's basically the medication that's used in nuclear medicine that's ingested by the patient and they become radioactive. And shock.
But what are radioscopes?
Radioscopes.
It says the definition here says pharmaceutical compound that
Are
is
you good?
attached to a radioscope.
You talk about me.
Radioisotope.
Oh, I read wrong. What are radioisotopes?
Radioisotopes are basically substances that are radioactive that are used in nuclear medicine.
They're actively degrading.
Correct. And shock. What happens when we have shock?
Something with your body.
Emergencies.
Great answer. So that shock happens when we have inadequate blood supply within our body. To the brain.
Mm.
Resulting in very low oxygen levels. Alright, moving on. So, contrast study. Why do we use contrast in imaging?
So we can highlight what we need to see.
Yes, to visualize anatomic structures that are not normally seen on a diagnostic medical image. With regular x-rays, do we usually use contrast?
No.
X-rays, yes.
X-rays?
It is all the time contrast, right?
Yes.
I mean for C,
Like a
I mean
barium.
X-rays.
Barium.
Yeah, for CT. Yeah.
Barium
No.
or CT? What did she say?
Oh, no.
Fluoro, x-rays.
Oh yes. Oh, I was like, wait a minute. Regular X-rays, no.
Yes. Have you guys done any portable abdomen x-rays after they inject contrast?
I've seen it on the X-ray though.
Oh, okay.
But, mm-mm.
Usually, sometimes if the patient's not able to travel downstairs and they just need to quickly see if a tube is out of place, like a J tube or something, they would inject the contrast at the bedside and then you would just take the portable x-ray right there.
I've seen on a regular X-ray, a woman went and did a CT first or something,
Mm-hmm.
and we took a regular X-ray, and I was looking at it, and I was like, "Is that contrast?" But I wasn't sure, and then
Yeah.
the guy asked her, "Hey, did you go get a CT first?" And she was like, "Yeah." You know, I've seen it like that, but not a portable yet.
Yeah, sometimes for abdomen or colon CTs, they do use barium also. So basically, the purpose of a contrast study is for us to visualize any anatomy that we need to see, and in order for us to see it, it needs to look different than the surrounding tissues, correct?
Mhm.
So what does barium do? It enhances that tissue and makes it look brighter.
Mm-hmm.
Do you guys know what contrast resolution means?
I do that.
Like two.
Yeah, big dip and.
I know Mr. Funk
When
taught you
two
guys that.
structures that's
Two
close
structures.
together, you can tell the
Differentiate.
Yeah,
difference.
So the
differentiate.
definition is the
That part.
ability to distinguish between structures of different density. So for example, if you need to tell the difference between pancreas and the liver, they need to have different contrast resolution, right? If they have the same contrast, they're all gonna look the same,
Mhm.
right? And why do they look the same?
Because they absorb the same amount or reflect the same.
They have
Yes,
similar
because of the
atomic number.
absorption characteristics of the tissues. So if a tissue has a high atomic number, that means what?
It's gonna be less.
Brighter,
Yes.
because it's absorbing all of that X-ray, correct? So, what's the relationship between absorption and contrast? Is it directly proportional or inversely proportional or what?
If absorption increases,
The more it absorbs, the
contrast decreases.
Yes, so
Yes,
less
it is.
absorption is less contrast, more absorption is more contrast.
so then
For example, air,
It
does
does absorption.
X-rays absorb by air or does it go straight through?
Go
straight through.
That's why it looks very dark,
Mhm.
right? Barium, it absorbs almost everything,
So
that's
it's
why it looks
bright.
super bright. And so, based on that, do you think barium has a high atomic number compared to air?
yes.
It does. Alright. So, these are some of the factors that affect the degree of radiographic density. Density is basically the difference in contrast that shows up on the image. We have 5 of these. So, depends on the absorption characteristics of the tissue. What does that mean?
How much the tissue
Depends on how dense it is.
absorbs or transfers.
Correct. For example, like we said earlier, bone versus air, correct? Technical factors, KVP and mass. If we use more KVP and mass, it will affect how our contrast will show up on the X-ray. What controls contrast, by the way? Did you guys learn that yet?
Who controls it?
Yes. Yeah.
Okay, we can-
KVP, did you guys learn that yet?
And like
Yeah,
we had,
yeah.
KVP, Mr. Khan's gonna be disappointed. KVP affects contrast, correct? It controls contrast. Type of IR. So lately we have flat panel detectors, which are very efficient in producing great contrast resolution. And then use of contrast media. Of course, if we use contrast, that's gonna affect our contrast resolution, right? And then image processing software. Nowadays with the fancy digital equipment, we're able to, you okay?
Oh,
That's
We're able-
it's fine, and they must have combined, uh-oh.
Do they really have your back?
We're able to manipulate how the image looks, right? You've probably seen the text manipulate the image after to make it look nice and
Always.
bright and
Always.
whatever.
pretty much.
Yeah,
I had a question.
so just know this for your test, yes.
I had a question about contrast. How come it's like clear in the whenever you like the actual thing is clear, but whenever you put it in, it looks like
Looks white.
yeah, like it's so.
In simple terms, physics.
Okay, that's good to know. Yeah. Yeah, one of the residents, like he was like a first year in fluoro, he was doing, it was just a knee, and for, yeah, the little injection, yeah, and, he was shaking so bad that it, like, whenever he was pulling out the contrast, it like got everywhere.
Cause he was nervous?
Yeah.
Aw, poor thing. He'll get over it.
Kirby's over here like, I wouldn't want him touching me. Yeah, cause then after that, he had to do the spinal.
Stinky boy.
I'm like, yeah, don't touch him, please.
So, tissues with higher atomic numbers absorb more X-ray photons. Example, bone. By the way, it's the calcium within the bones that give it that higher atomic number, not the bone itself. So the calcium within the bones makes it appear very bright. So compared with bone, soft tissue transmits or creates more scattered photons, leading to less absorption.
That's absorption.
That's correct.
So soft tissue has less absorption than bone.
I thought you said more.
Yes.
Yeah.
That's that.
Because it has a lower atomic number, correct? So, anatomic areas with low subject contrast result in few density differences. What do I mean by that?
If the density difference is not too much, the contrast will be not too much.
So like
Exactly.
the liver and pancreas,
Mhm.
the density is not that much.
Yes, so they have low subject contrast, right? Contrast resolution is low. When looking at, let's say, chest x-ray, we see the lungs and the ribs. The contrast is high or low on a chest x-ray?
High, because
High.
ribs will be high.
Because lungs are very black, bones are very bright. But on an abdomen, compared with the chest, the contrast resolution is lower, right? Because it's all shades of gray, not
Mhm.
so much black and white.
Mm-hmm.
So the important thing to remember is anatomy with lower atomic numbers leads to less absorption, equals less brightness on the image.
Say that one more time, please. Anatomy with.
Tissues or anatomy with lower atomic numbers leads to less absorption of the X-ray, so less contrast.
He's like, this could be like carrying.
A little bit.
Does contrast have more atomic number than metal?
Contrast, barium, I believe the number is 56, so it is quite high.
Than metal.
Lead is what?
I don't know
Lead is
the
Comparison.
atomic number for metal. So, here is a picture of the abdomen area, and these are the 5 different densities that the picture has. Air or gas, we see it here, right? Fat or tissue, what are these?
Kidneys.
Kidneys. Water or fluid, we see it here and here. Bone, we see the L spine very clearly. And metal, where do we see metal?
Something white, I don't know.
Can anyone tell me where they see metal? Jay.
The marker.
The
Obviously
marker.
the
What's in our markers?
Lead.
Lead. That's metal. That's why it shows up so bright.
Lead is 82.
You can't see the soft
You can see your.
Soft tissue over here
tissue. Yeah, like the bottom.
because it has low contrast.
Oh.
Water and fluid, where did you show that?
Right there.
They're trying to show the ureters.
Correct.
The
We're
black,
looking at the
the
kidneys
white.
and stuff.
The white.
Yeah.
The white is the,
Oh no,
the
I'm just
ureters.
talking to myself.
Leaving the kidneys.
Oh, I see.
Yeah.
Down to the bladder.
You're right. Yeah.
So, enhancing the density differences within the area of interest will improve visualization of the anatomy. For example, we enhance the density difference between the ureters and the kidneys, right? So it makes it easier to visualize. When we take a regular abdomen x-ray, what sort of anatomy do you visualize?
The stomach.
Translucent.
You can see the stomach really clearly? What
It's
can you
dark.
see clearly?
The kidneys
The bone?
and the.
The spine,
Oh.
right?
I thought you were talking about what was okay.
Right. Are you able to see the small intestine or the large intestine on
If
a
it has-
regular abdomen x-ray?
If it has,
If it got poop, it got large.
small.
Unless
Barely, right? But if the patient were to have barium, it would show up very brightly,
Mhm.
correct?
You see
So
it.
intestines have high or low subject contrast.
I guess I don't know.
By the way, when we use the word subject contrast, we're talking about specifically that anatomy. So intestines have low subject contrast. Bones have high subject contrast. Example right here. What kind of study do you think that is? Variant study?
I don't know.
What are the different studies that you see in fluoro?
That's a
Upper GI, yes, because what is this, do you think? It's the part of the stomach, right?
Oh.
Oops, a little bit.
It's like fecal matter.
Why is the stomach cut out like that? Doesn't look
I
like,
don't know.
doesn't look like a stomach.
So we see the spine here, we see part of the stomach here, right? So if we didn't use contrast, it wouldn't be easy to visualize. This is an MRI of the brain using contrast. Anyone know the contrast that we use in MRI? Gadolinium.
How did they inject it to the brain?
Through
The
vessels.
IV. Through the IV.
So they pick certain vessels that they want, like it'll take you to certain places that they need to see?
No, so if you're doing an angiogram, which is basically looking at the vessels, it all depends on timing and using like a very big vein. So we're probably gonna use like a big vein in the elbow, and then the timing, basically the timing from the time when the contrast is injected to time when the scan starts is probably gonna be very quick, and it shows up super bright. Okay. So, contrast agents are generally classified either as negative or positive. Can you give examples of a negative contrast? Air, right? Gastrographin is negative or positive?
What do you mean by negative and positive contrast?
So, negative contrast agents show up very dark. Examples are air or CO2. Positive contrast agents, they show very bright.
Right.
Why do they show bright?
Because they absorb.
Because of the high atomic number, which means it absorbs more X-rays, right?
Yep.
And the purpose of using contrast media is to increase the atomic number of the tissues. For example, I said earlier that the intestines usually, they don't appear very bright because they have a low subject contrast or a low atomic number. But introducing barium, what does it do to the tissues? Makes it appear very bright. So, higher atomic number equals more contrast. Lower atomic number, less contrast. And then remember these two relationships. Negative contrast agents decrease attenuation, for example, air. Positive contrast agents increase attenuation. What does attenuation mean?
Absorption and scatter.
Yep. Basically, that stoppage of X-rays, right?
Now you speak Latin.
You have to make Mr. Fun.
Because it absorbs.
It's too early. Wait out to lunch.
I need one-on-one
What time
time
is
too,
it?
by the way.
Now because it absorbs it, it stops it.
Correct.
10:56.
Huh?
She was asking for the time.
What's an example?
Oh.
You tell me.
Uh-oh.
What appears bright?
Mm-hmm.
What appears bright? Barium. Barium, omnipate, visipate, they all show up very bright. So those are positives. Negative, it's only air and CO2. Everybody on track so far? Nice. So, this is important to remember. So, the higher the atomic number, we already said it means higher absorption, correct?
Mm-hmm.
So, what does photoelectric interaction have to do with absorption?
It's absorption. It absorbs it.
So, photoelectric interactions result in X-ray photons being totally absorbed and not striking the image receptor. So, introducing that contrast media enhances photoelectric interaction.
Can you explain that, man? What you meant?
So, photoelectric interaction, what happens to our electron during photoelectric interaction?
Because absorbed.
Anyone want to explain?
The
What
photons
happens?
get absorbed.
I wrote. Jay, you have an answer?
What is the question?
What-
Sorry, I feel like we've.
What happens during photoelectric interaction? What happens to our electrons and like what exactly happens?
The electron fired is completely absorbed by the atom it's interacting with or the target. Therefore not hitting the RR, leaving the image in the body and not on the plate. So if you think of it
Yes.
as
So during photoelectric interaction, the X-ray photon is totally absorbed by the matter that it interacts with, right? So, have you seen X-rays with patients that have like hip replacements and stuff?
But
Okay, have you seen X-rays with barium or contrast?
in the fluoroscopy.
Yes, so it looks very bright, correct? Because what's happening?
Because we to absorb.
X-rays are being absorbed by the barium, so it's not reaching the IR. That's why it looks very bright. And what's happening? We're having a lot of photoelectric interactions.
This is photo, the absorption that is taking place is called photoelectric.
It's caused by all of the photoelectric interactions that are happening within the barium and the tissues. So if a tissue has high atomic number, that means
More
more
absorption.
photoelectric interactions.
More photoelectric.
So introducing contrast within a tissue will increase what? Photoelectric interactions. Make sense? Or did I lose you guys?
Because somewhere it will be absorbed more and somewhere it won't be absorbed.
Yes, so contrast has high atomic number, correct? It appears very bright. So, if it appears very bright and it has
Absorb.
it does more absorptions, meaning,
Photoelectric.
yes. I think we'll stop there for today.
Yes.
What do you guys think?
Boy.
My brain is a lot.
Dying. I feel like that's enough confusion for today.
Oh, yeah. That's the one you need? I know it's hard to find.
I need food.
Oh my gosh.
We need sustenance.
I need
I'm
some.
so hungry right now.
Oh, on that, I not it, or how you say it, it is positive and negative.
Okay,
Yeah.
so ionic is positive and negative.
yeah.
Yeah, it says atom or molecule have a negative charge or positive charge.
So a molecule with a negative charge would be what? Cation?
And,
It says anion. No, it's really loud. Okay, negative charge is anion, positive charge is cation.
so that's what she was asking.
What is cation is positive, cation
Anion.
Is negative.
It says anion is negative and cation is positive. Yeah.
This is a
Yeah, y'all better not get it mixed up with
You gonna search me?
I get my noodles today, but I got some extra change, so I'm gonna see. I'm gonna say